Okay, what's going on, everybody? Thank you so much for joining us this evening for our second webinar that's talking about our platform, My Retina Docs. It's a platform from our organization, Aspire Health Solutions, and we're excited to bring it to you. So we're celebrating, and that's the reason for the hat. And all right, enough of the hat. Okay, so that's the intro here. So we're basically, thank you so much for joining us. We're going to give you an overview of what it is that we're doing and how you can help to be a part of this pivotal change in how optometrists render care. So the way I think about it, optometrists have been getting paid to do the same kind of thing for a long time, and not, I guess, only until my lifetime did that change a little bit, when we went from just being a bunch of refractionists to being medical professionals that we are. I think this is the next evolution of the career of optometry. Basically, the way I see it is that our value comes from what we know way more than what we can do with our hands. And so I think that being a telemedicine or retinal review doctor is a really good example of how we can get paid more to do, to use more of our intellect and use the experience and the expertise that we bring as optometrists. And so this is the perfect opportunity to do that. So I wanted to just thank you guys for joining us. And I see we have a couple more people on the line here. So I'll just wait for a couple of people to come on. But what I want to show you guys is basically an introduction to the My Retina Docs platform, how it works. If you guys have any questions, you should be able to submit your questions, and they should be appearing on my screen. If you don't see that, send me a message on Facebook, and I'll see if I can fix it, here. But what I'm going to do is, in just a few minutes, I want to show you guys what the My Retina Docs platform is. We're basically out of alpha, and we're into our beta, and so we're in a pilot program now with our beta platform. There's a whole bunch of changes that are going to be coming up, and we're just really excited to bring it to you guys. So let me dive right into it. Okay, so I'm going to share my screen with you guys. Okay, and right now you should be looking at the dashboard. So this is the My Retina Docs platform, and this is our dashboard, is what it looks like, and it's a pretty clean, easy to read platform. All right. Basically, this area over here is just recent patients. Top left, the top right is the today's appointments. Bottom left is the images screen, and the bottom right is for reports. So as a reviewing doctor, what we're looking for is we're looking for images down at the bottom that are pending. So I'll give you the whole process that the nurses are going to be going through, or the imaging technicians are going to be going through. Basically, they'll open up the patient for the day, and they'll go directly to the images, and at which time they'll input some images. So here's some images that were already input. Let me get a new patient. Aria. All right, so good. There you go. So zero images there. So I'm going to add some images. Okay, so I'll do a. Let's see here. Take that one, and I'll take this one. And these are images that come from our cameras that we have been using. Save. So now when the doctor is when a doctor is looking at their appointments, they should see that there are images that are pending for review. So one of our doctors that is an imaging and review doctor would just tap on the images that need to be reviewed, and would make the decision as to whether or not there's a good enough image to review or if it's rejected. So we would just accept it. These are both good images, and then add them to the report. So that's the right eye, and then this is the left eye, and then our doctor would then push save, and that's it. There's a little bit of a lag on this, but if you were to walk away or anything like that, then within a few 60 seconds or so, the images should pop up under the pending screen here. So we're still waiting for it to populate. It's on like a 60-second cron job. So I'm just going to skip this part so that it, understand how it works. It will pop up there, but since we know what images we're talking about, I'm just going to go ahead and go right back into Aria's images. Okay, this is her report. Basically, I can look into her chart. All right, I'll go to her report. There are the images that we just put in. Okay, and I would add an assessment. Well, before I would do that, I would want to review the image. So you tap on it, and it brings up the ability to zoom in on the image, and you see, okay, maybe there's a couple of drusen there. All right, nerve head, it's okay. All right, but the important part is that since mostly all of our patients are diabetics, is there any diabetic retinopathy in the 30 to 40 degrees that we can see on this image? And the answer is no. I don't see any diabetic retinopathy in this image. So I'm going to say that this patient has diabetes without any diabetic retinopathy, but there is some drusen that they should get checked out with their PCP, with their primary eye care doctor. And here's another image. Okay. Nerve looks okay. Macula looks great, and more or less, this is what is a pretty healthy looking eye as well. So in general, I would say that this patient has no diabetic retinopathy. So I would click on the assessment. There's two ways to do it. You have the add comment or add an assessment. Add comment is basically free text. You can put whatever you want here. And the assessment here, I would do right eye, diabetes type 2 with no diabetic retinopathy. I want to make a little line just for some formatting. Left eye, select this, and now I'm going to assess the left eye. So I'll make another assessment. Again, the left eye is fine, so we'll do an assessment here. The same thing, diabetes without any kind of retinopathy. All right. I could also add some, add that there's some drusen in there, but I'll just do this right now just for the sake of time. I'll do a plan. And I'm going to have them just continue with routine annual eye exams with the primary eye care provider, which is an optometrist or an ophthalmologist. And then you can just press select right there. Beautiful. All right. Who's assigned by? And my name is Vincent Calderon. And I'll put my New York license number. Okay. And press save. And before I do this, I want to make sure that, yes, everything is there the way I want it to be, because once you press save, there is no turning back. There's no way to fix this image. You have to call us and you have to reissue the image, and it'd be a big pain in the butt. So just before you do that, make sure that you're doing that, everything you want is on that report, and you just press save. And that's it. The retinal report is completed successfully. Excuse me. So if you go to reports, and then up top of the completed there, you'll see that Aria Stark is there. So if you wanted to look at it, you just press that print button down there, which you could print it from a wireless printer or not. But here you go. Here's basically the image. So you have this is the report. It's what it looks like. You got the right eye, left eye. You got any appointment notes, which would have been put in by the NP at the time, which tell us about diabetes and things like that. You can how long or what kind of medications they're on. That would be under the appointment notes. The assessment, right eye. It was type 2 diabetes with no retinopathy. Left eye, same thing. Plan, continue with routine annual eye exams with a primary eye care provider, signed by me with my state license number, and then the important disclaimer on the bottom, which basically tells us that this report does not replace a routine eye exam. It's basically for diagnosis treatment. It's not for the diagnosis nor treatment of ocular surface diseases, nor cataract, nor glaucoma, nor peripheral retinal disease. And basically saying that this is just for what we can see on this image. It's a big issue for a lot of people, obviously, and it should be. So now that I went through how the report works, it's pretty self-explanatory. Like, that's it. The images are something. I want to take the screen back here. Okay, so the images are uploaded by our NPs that are our nurse practitioners that are out in the field, and they're actually performing a full physical. And so what we'd ask our doctors to do um, is to just be mindful of your appointment time. We'll let you know at the beginning of the day what time your appointments are at, because the MPs will be there for about an hour and a half with the patient. So once they sent the photo, they'll do that at the beginning of their assessment. So if you're mindful of your application, then you can report on it, and they can give back in real time pretty much the results out to these patients that could be anywhere in the country, really, but mostly these are patients that are not getting routine eye exams. So this is the benefit that we bring, and it's really an amazing service that we're providing. So we're looking for optometrists right now that would be interested in doing this type of work. As you saw, it's pretty self-explanatory. We're assessing retinal images just like we do in our practices every single day. We're just using a little bit of technology to help us, and that's it. We're reaching a lot of people who otherwise would not be getting eye exams. All of our patients are diabetics, and this is the beginning of a much larger program that we've been implementing since pretty much last year. So if you have any questions right now, feel free to ask away, and I'll answer them. Okay. So it took about 11 minutes to do the whole review. I'll give you a quick summary about our business and our business model and how we came to be. Aspire Health Solutions started seeing patients mobily in 2010, and we quickly started seeing patients that needed to have diabetic eye exams done. We ended up kind of falling into a contract with a local Medicare Advantage plan, and we started seeing all their diabetics. And this was kind of the next evolution of that, allowing for technology to help us to be more places than we can physically send our doctors. Now we can send technicians in addition to sending out our doctors, and it's been amazing. And the community or the industry has definitely spoken up, and they like what we're doing, and the interest has grown greatly. So we're excited too. So that's what we're doing, and we're looking for doctors to be a part of our network of optometrists. There is another organization out there that is doing something similar. I think it's more cumbersome. I think that our platform is quicker, faster, easier for everybody. And that other organization doesn't use optometrists, so then we'll be the optometrist organization. And I think that we're going to see some really, really awesome things happen in 2016 and definitely 2017. So we're building up our network of ODs. We are doing really well. We have doctors across the country. I'd like to consolidate the numbers of doctors that we have. So we're looking for doctors that have multiple state licenses. That'll be awesome. That allow for us to work with less doctors, give more doctors more work. And I'm looking for the first time that I can replace a doctor's income in the office by doing purely teleretina medicine, which is a goal that I hope to be able to achieve by the end of this year. That would be really, really awesome. So maybe it'll be you, so it's definitely something that we're excited to be able to present and do. And I think that going forward, it's going to be the way that optometrists can choose to practice. Telemedicine isn't going anywhere. Diabetes isn't going anywhere. And there will be no shortage of doctors that are qualified to do this type of work, where rather there is a shortage of doctors that know about doing this kind of work, but there'll be no shortage of work for those kind of doctors that want to do this type of work. And so if you have questions, please do just put them into the questions bar. There should be a bar here somewhere. If there's not a bar there, then just send me a message on Facebook, and we can go like that as well. Let me log into my Facebook so I can see any messages if they're coming through. I should be coming through clearly. Let's see here. Okay. All right. So if you guys have any questions and I'm not seeing them on the broadcast, then feel free to send me a message on Facebook. But that's it. I basically did the entire presentation, and we're looking for more doctors. So I guess we'll hold off for another couple minutes, and if you guys don't have any questions, then you can just send me a message on Facebook or call me 718-749-7027. That's me directly, and that's it. Okay. So I'll leave you guys with a little. All right, guys. Well, again, if you guys have any questions, then I'm gonna end the broadcast. Okay. Wait, before I go. So right now, no, we're not providing doctors with iPads. iPads are so ubiquitous that it just doesn't make any sense. So, and right now, yes, it is only an iPad application. We are in discussions with a group to create a Android application, but for right now, all of our clients are using iPads, so iPad application it is. We are definitely going. Let me get this stupid hat off of me. Right. Hold on. All right. So yeah, so we're not going to be providing iPads. Just it makes the logistics way more complicated. Then we have to worry about inventory, and we have plenty of them, but it's just easier if everybody just has their own iPad. So yes, that'd be the prerequisite. You have to have your own iPad. I think that an iPad Mini now is like $300, $299. It'd be a good reason to get one, tax write-off, all that other good stuff. But yeah, you have to have an iPad. You get to download the application for free, and we would start giving you a schedule as soon as we got all the credentialing information from you before we got started. But right now we have a need in Montana, Texas, and New Mexico. I just got a word yesterday that we likely will be needing a doctor in New Mexico. So if you know someone, let us know. In addition to that, we're going to need Georgia, South Carolina, Maine, New Jersey, and a couple other states. But right now, the most pressing are the Texas and the Montana doctors. The rate of the reimbursement is anywhere between $10 and $20 or $25, depends on the contract. I mean, if we're doing, we have the ability soon to be giving out about 50 to 100 per patient. Per doctor report per day. So if you did that at $20, that's $2,000, right? Yeah, that's $2,000. Which is, if it was 100 patients, it would take about 100 minutes, and because it takes about 60 seconds once you kind of get through the platform. It's super fast. And what I did mention on our last webinar was that this is just our first iteration of the platform. Okay, it's our first iteration. Our next iteration of the platform is going to be very much like Uber, where you get a notification on your phone, you open up the application, you punch in your code to log in, and you see the image right away. You tap on it, you make an assessment. You tap on it, you make an assessment, and that's really that's it. It'd be that fast. It'll probably take you about 30 seconds, and you can do that when you're on your way to the grocery store, on your way to pick up your kids from basketball practice or whatever. You can do that in between patients. You could do that kind of while you're doing whatever it is that you were doing, and our goal is, like I said, is to be able to get enough of these images done where an adjunct to a doctor's salary, you're doing it kind of whenever you want to be on and off, kind of like an Uber driver. That's one of the appealing things of being an Uber driver. You can work when you want. Well, this will be kind of like that as well. Initially, obviously, we have our volume's not as much as it can be or will be in the future right now. So we have a little more restraint on how much and how many doctors we can have on. But in the future, when our next iteration of our platform comes up, literally you'll be whipping out your phone, doing a quick login, like a 4-digit code or whatever, just for the HIPAA reasons. You'll look at an image, you'll review an image, you'll click to the next one, you do the same thing, and you put your phone away and you're done. So that's really where we are with this technology. We are, you know, this no longer a sci-fi. This is real, and that's why we're excited to be a part of this. So, and you guys should be excited about, because you're a part of this too. So thank you. And if you have any questions, again, please do feel free to submit them. And if not, send me a message on Facebook, Dr. Vincent Calderon, Dr. Vinny Calderon, and that's it. So again, if you guys have any questions, please do feel free to message me. Okay. All right. Thank you. Just wait a couple more minutes for you guys to finish any questions. All right, guys. All right, so thank you very much, and please feel free to send me over any questions or messages if you're interested. If you know any doctors in New Mexico, we could definitely use it. So thank you very much, and we'll talk to you soon. Take care.